As Batty was heading home one rainy evening after hanging out with his friends and having a swell time watching these Mexican girls dancing, he felt just a bit guilty that he had promised his wife he would be back home by 8 p.m. Batty never, ever thought he could ever be in a position where a girl would be performing CPR on him, let alone two. Another thing nagging Batty's mind as he walked home was what his cardiologist had told him yesterday. His heart doctor had told him that his fragile heart could fail and go into cardiac arrest anytime if he continued his dangerous lifestyle of drinking alcohol, eating anything he wanted, and refusing to stop smoking. His heart, which looked like this, could just suddenly develop an abnormal rhythm and go into ventricular fibrillation, causing his heart to go into cardiac arrest like this. If he was lucky and the automated external defibrillator pads were placed on his chest early enough, and the shock from the automated external defibrillator, otherwise known as the AED, was delivered early enough to shock his heart into having a normal rhythm again, he may just survive that cardiac arrest. Before that, however, as he slumped on the ground, these two girls happened to just be nearby, and they immediately realized he was unconscious. After they spoke to him and shrugged him, he didn't respond. He was not breathing, and the two girls didn't appreciate any pulse. Gloria and Gift, those were their names, immediately realized that there was no defibrillator nearby, and so they needed to start CPR, cardiopulmonary resuscitation, immediately. They immediately bared his chest, and Gloria placed one hand at the middle of Batty's chest, and then proceeded to place her other hand over the first one. And immediately Gloria and Gift started compressing Batty's chest. If only Batty could see how his chest went down by about 5 centimeters and how his chest was allowed to go back up again before Gift and Gloria continued his chest compressions. Gift and Gloria knew what to do in CPR. They knew that once they started compressing Batty's chest, they should never stop CPR until medical help arrived. They also knew that a good CPR should be between 100 to 120 compressions per minute. When Aminu was teaching them CPR, they remembered that he had said that they should decrease interruptions while compressing the chest, meaning that as they are doing CPR, they should do it continuously without any break. By allowing Batty's chest to come back up again after compressing it by 5 centimeters, they were allowing the chest to regain full recoil before the next chest compression. Like this, Gloria and Gift were pushing hard during the CPR because if they don't do this, they are not doing CPR properly. Fast, 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 fast. Push fast. That's it. What happened to Batty's heart when sudden cardiac arrest struck him? Batty's heart was beating effectively and was delivering blood and oxygen to every part of his body. But when sudden cardiac arrest struck Batty's heart unexpectedly, his heart stopped beating effectively and the blood flow stopped. If Gloria and Gift had not intervened, his brain, his vital organs, and his heart would have begun to die. So, by beginning CPR, Gloria and Gift were giving Batty his only chance of survival brain damage would have certainly started to set in Betty's brain within 4 minutes. And after 10 minutes, his brain damage would have become irreversible. These two girls had the power to save Betty's life in their hands. So, by performing prompt CPR, cardiopulmonary resuscitation, Gloria and Gift had ensured that two very important things had happened to Betty's body. One was that by compressing Betty's chest, they had moved blood which had oxygen to Betty's brain to keep his brain alive. The second thing was that by doing these chest compressions, blood and oxygen had been kept moving through Betty's heart muscle itself. What was important about this? Well, so that his heart would have the best chance of resuming a normal electrical rhythm after the shock from the automated external defibrillator was delivered. As Gloria and Gift begin compressions, they are creating an artificial pump and doing the work of the heart manually. With each good effective compressions, they are building up pressure in the system which will move blood around the heart and up to Betty's brain. It does take time to get the blood moving with CPR, so it's very important for Gloria and Gift to push hard, to push fast, to build the pressure up. This pressure will keep blood going to Betty's brain. Pushing down at least 2 inches allows for Betty's heart to be squeezed and blood to be moved out. Pushing his chest at a rate of 100 to 120 compressions per minute is necessary to keep Betty's blood pumping. Now let's see what happens when we take off our hands from Betty's chest. Blood stops going to Betty's brain. It is for this reason that if Gloria and Gift take off their hands from Betty's chest to deliver breaths or switching roles, it is critical for them to minimize the time off Betty's chest. Now watch what happens when Gloria and Gift don't push deep enough. Blood does not reach Betty's brain. This is true when we don't push fast enough. Watch what happens when they push too fast. Now, Betty's heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when Gloria and Gift don't allow the body to decompress and allow the chest to fully recoil. The heart does not have the chance to refill with blood. Therefore, no blood gets pumped out. So remember, just like Gloria and Gift did, the key purpose of delivering compressions is to keep blood that has oxygen moving within Betty's heart and up to Betty's brain to keep Betty's brain alive. We need to push hard and push fast in the center of Betty's chest. If Betty's ribs break, that's okay. What's not okay is allowing Betty's brain to die from a lack of oxygen. So Gloria and Gift remembered that they were Betty's only hope. They did their best until medical help arrived or until an AED was present. Haha, we can all do it. Watch this Save a Life playlist